Hi guys, welcome back to my channel. For those of you who are new here, my name is Harang Choi and I'm undergoing the USMLA journey. But on today's video, we have a special guest with us who recently underwent PLAB 1 and PLAB 2 exam, and I thought that her experience might be helpful to all those who will be undergoing this journey, and so I am interviewing her today. And so let's welcome Dr. Sienes. Hi Sienes, thank you for joining us today. And before we start, can you briefly introduce yourself?
Hi, thank you so much again for having me in your channel. Hello, everyone. I'm Alexa Sienes, and I'm an alumni of Ateneo School of Medicine and Public Health. And I'm also batch 2020, like Sarang.
So the first question I have for you is, since you are undergoing the UK journey, what made you pursue the UK PLAB route after graduating from med school?
Oh, well, actually, to be honest, I only really started considering the UK PLAB route around April or May of 2020. So that was around the first few months of lockdown. So at the time, before then, I was already planning on going straight to residency and then become a consultant in the shortest timeline possible. But then the pandemic happened and I was forced to stay inside. We were all forced to stay inside. So from 36-hour duties or, from very hectic schedule that we had as interns, we were forced to slow down and really it felt like the days were super long at the time. So I had all the time in the world to think about I just ended up thinking, like, what do I really want in my life? What are like my priorities? What do I really want to do? And what timeline would I have for the future now that everything is super uncertain? So I had a lot of time to think about that. And I realized what I really wanted to do was I wanted to have work-life balance moving forward. And I realized that's really one of my priorities because, I have a lot of hobbies that I don't want to give up. And I also really liked having the time to spend with friends and family, even though we're just at home, being able to catch up and being able to spend time with my loved ones was also important to me, and being able to support myself. So I put those as my priorities and then looked for the different options that were available to me. So that was when I found out about the UK PLAB route, and after looking some more into it, I also saw that, there's a lot of chances to travel. And of course, even with the pandemic, that's difficult. But, eventually afterwards, we could do that. And that was very tempting for me. Yeah. So at the time, I thought I really wanted to make the most out of my life. I wanted to explore and learn as much as possible. And I didn't really want to wait much longer because, we just have like a short life. And, we don't know what's going to happen. Like, especially with the pandemic, I really think that
so many
a lot of people... Exactly. And, a lot of people changed their plans because of that. So I looked into the process. I researched a bit more about it. And as soon as I decided that I wanted to do it, I booked my IELTS exam at around June. And then the rest is history.
That's great. Okay, yeah, I agree that during the pandemic, when we had lockdown, we had more time to think about all these things, and I think that's also when I was like trying to decide what to do. So I know that you finished both your PLAB 1 and PLAB 2 exams during this pandemic, and so much respect for that. And can you first share with us how you prepared for the exam, when you took it, and what your experience was taking your PLAB 1 exam?
Oh, sure. So the PLAB 1 date that I booked was for the May 2021 intake. So that was a few months ago. And I booked it at around October of last year.
Okay.
And but I didn't really get to start studying until around 2 to 3 months before the exam, because when I was looking at the Plabable subscription plans, there was like a 6-month plan, and it was like too far away for me. And there was a month plan. So I figured one of the good things, I guess, about the pandemic, even though it was super hard at the time, was being able to experience studying at home for the board review. So in the Philippines, I also took the physician licensure exam, or the PLE, and we did all of our reviewing online. So I already knew what worked for me in terms of studying. And I knew that if I studied more than 3 months, it wouldn't stick as well. So I started studying around maybe February, March. I think like the experience of being able to study for the boards here really helped with my preparation for PLAB, because although the content differed, they were both MCQ type questions. So it was easier for me to strategize. I could just what I did for the boards, I just used flashcards and mock exams. And I did the same thing for PLAB 1. I really just studied through PLABable. And there are a lot of people who say that it's enough for studying PLAB 1, and I totally agree. I didn't even get to finish my question bank when I took my exam, but it still
How many
worked out in
questions
the
are
end.
there in the question bank?
At the time, they already had 2,100 questions, but they keep on adding every time. And they allowed you to take mock exams as well. So my preparation involved trying to do questions in my spare time at work. Like a lot of the research that I did told me that it is much better if I just study the concepts after every question, so it sticks better. And that's what I did. So I study really slowly, so I could only do usually like 10 questions a day because I would really research about each question afterwards. Yeah, and I would go through a subject, for example, cardiology, and work through the entire section before trying out the other questions in the other subjects. And I couldn't study more than a couple of hours, so I made sure to really be thorough with each concept I was reviewing. So the more questions I did, the more the material stuck. And it's really important, I think, for me to do the mock exams at least like once a week. So once a week or once every few weeks, because it also helped me gauge where I am in terms of my progress and to see if I'm improving. So even though there were questions there that I didn't study yet, I wanted to practice being in exam environment, timing yourself and making sure that you're pacing yourself correctly. That was really important for me as well, because the PLAB 1 has 180 questions. So you only get a minute per question, and each question is very long. There's like an entire case, and usually the questions would be around diagnostics, would be about like diagnostics or management. So it wasn't it was important that you don't miss anything. So I had to learn how to recognize the patterns from reading quickly. I'm sure you could also relate when you were studying for USMLE. That's kind of that's also kind of the same idea. And when I arrived in the UK, my exam location was in Edinburgh. I was able to do a lot of questions and mock exams as well during my quarantine. And yeah, so I think that was when I really got to study a lot, because we were just forced to stay in the entire time as well. Yeah, and by the time I took my test, I was so focused, I didn't even get to eat the snacks that I brought, because I really got to milk every minute of that exam. But it was really valuable that I was able to take a lot of mocks, because it felt like I was taking a mock by the time that I took the exam.
And you know how, because of the regulations, you had to travel? Like, how was traveling to UK and coming back?
It was pretty challenging, because I was able to apply for my visa in February, and I got it around March. But around that time, that was also the time that the UK released their red, amber, green classification for the countries. So Philippines was in the red list. Majority of the other countries were in the amber list. So those from the amber list are allowed to enter the UK, but they had to undergo quarantine. Whereas if you came from a red listed country, you can't enter the UK at all if you've been in that country for at least for like the last 10 days before your arrival. So what I did, I passed through an amber country first. In my case, it was the US. I spent 2 weeks there. So luckily I had family that I could stay with. And after that, I went to the UK. So at the time, it was very challenging to find flights, because there still was like there weren't a lot of people who got vaccines yet. I think by the time that I traveled, they just started rolling out vaccinations. So it was pretty challenging finding flights going back. That was the ironic part. Like, it was easier for me to find flights going out of the Philippines than going back, because there weren't a lot of people going to the Philippines at that time. So I guess the demand for flights was low. But eventually it worked out. I also had to look at all the places where we would do the layover, because they also had their own rules. And we had checked-in luggage at the time. I was with my mom, and it was harder to travel with check-in luggage, because you have to figure out if you have to get out and check in again. So I had to consider all of those things. It was very stressful, to be honest. Yeah. Thankfully, it all worked out in the end. I got home.
I know.
After my
PLAB 1. I was so happy to hear that you were back. So as soon as you were done with PLAB 1, you applied for PLAB 2 when you got the results, right?
Yeah, I tried. I mean, it was difficult to find slots for PLAB 2 because the only options I had were very soon in my timeline. It was already in the Philippines, and the slots that I could find were only like for next week. So it's like it's super hard. I know some people stayed there and just waited for their results and started studying for PLAB 2, but that was a more expensive option for me, so I decided to go home first. And it took a while for me to book, actually, because I couldn't find one that was far enough ahead in the future. I like, at the time when I got my results, it was June or early July. I think maybe like June. I got my result at June, but I was only able to book in July because I had to wait and keep on refreshing. And luckily, I had a group of people that I met online who I joined for a group discount in one of the academies. And one of them told me that a lot of slots opened up. So when I refreshed, I was able to find a date in September, which is the time that I wanted to take my exam. So that was super lucky. I was able to get an exam for September 16th. And by the time that it was pretty lucky because I already started booking my flights and just thought that maybe I would just book when I'm there in the UK. But luckily I was able to book
the test date.
Before I had to fly. So that was very
good.
lucky. Yeah. But the compared to PLAB 1, the logistics part was a bit easier because I had family in the UK as well. But the preparation, I think, was more challenging for me because I didn't know how to go about it. It wasn't a kind of test that I was familiar with, like the format. It wasn't MCQ, so they tested more the communication skills that you had with your patients. I mean, they also, it was also important that they had the clinical knowledge, but I think it was also important for them to see how you would build rapport with your patient. And that's not something that I could just read about or, just do with flashcards.
That you have to practice a lot, right?
Yeah. So it took me much longer to get into the groove. Like I enrolled in an academy and they gave me scripts, and I was able to access a lot of lecture videos from home. And like what I mentioned earlier, it was more of a communication thing. So I needed to be able to practice with other people. And I think there's also the challenge of time management, because each station in PLAB 2 consisted of, you were supposed to interview the patient and diagnose them and manage them within 8 minutes. So you had to be able to do all of the steps correctly while following guidelines and making sure that all fits in the 8 minutes. Because I think a lot of the score that you also get for the station was how you would explain to the patient their management. So that was a challenge. But I was able to do most of my preparation in the UK already at the time. I stayed there for, I think, 6 weeks. And that was the time that I was able to study because I wanted to do on-site mocks. So even though I didn't really attend the classes for the academy, I mean, they gave me access to the lectures, but I didn't really finish them because they took so long. And, a bit of a struggle for the first few weeks because the script had 1,000 pages. And, I didn't want to memorize, and it took me so long to read them. I mean, and like they were. I mean, I don't want to say like they were pretty boring because of course like it just felt like I was reading a script for like a play or something. So I didn't really get to the groove of it until later. But I asked for advice from Kim, who you also interviewed in your previous videos. I asked for advice from her, and she advised me to focus on refining my approach. And I think that was when it really clicked for me. So instead of memorizing what I was going to say for every case, for every illness, I decided to focus on my approach. So for each patient, I'm going to ask them about their chief complaint, the kind of
set of questions.
The set of questions that I could just modify on the go. So I think that I was able to make an algorithm that I was able to apply for all kinds of cases. And I think that really helped me more than memorizing the scripts or studying what I was supposed to say for every single thing. And the mocks also really helped. I had a total of 4 mocks in my package, and I did one for every week leading up to my exam. So I remember getting super nervous even though I did all of those mocks. I mean, a lot of people already said that 4 mocks is enough, but I also look for practice partners that I could practice with, although everything was by phone, like all over the phone or in Zoom. That's where we did most of our practice. I really advise instead that, you could just go to the academy and attend the live classes, so it'll be easier to find practice partners. But, even though it's a bit hard, it's still doable as long as you practice by yourself and time yourself and really critique yourself. By the time the exam came around, I was super nervous because, of course, like, I didn't know if the preparation that I did was enough. I think we had 18 stations for PLAB 2 already at the time.
Okay.
Before, because it was the height of the pandemic, they had fewer stations. But during the time of my exam, it was a bit better. A lot of people were vaccinated already, so they were able to provide more stations, which was good because you also get more chances of getting
points.
A better exactly. I remember clearly that my station for the exam, my first station was station 17, which was right after the second rest station. So the rest stations were stations, I think, 11 and 16. So I was the only one who had to go through so many stations before I could do a rest station.
Oh, wow.
During my train ride going to Manchester, I was still cramming and practicing scenarios. There were some that I was really nervous about, but they did come out. so that's a relief.
Yeah.
But then there were others that I didn't review anymore and they came out. So, it's really, you just have to accept whatever comes at you. During the exam itself, the hours just flew by quickly. Even in my rest station where I had 8 minutes of nothing to do, I just ate cookies. They had cookies and water. You could go to the bathroom if you wanted. I couldn't even finish my cookies in time. So that was how fast it felt like.
Okay.
So I think like being able to see patients, felt like I was in the clinic and being able to do consultations a bit quickly. We already had that experience in internship. So I think that was very helpful as well. And the thing is with PLAB 2, I think even with the mocks, after every station, you could already have an idea of whether you did well or not. Like for me, there were a few stations that were difficult because I had a stubborn patient or someone who didn't want to give information. It was sometimes a bit hard to get information from that. So there were times that I know I didn't do well. So I had to compartmentalize and not make it affect my mood and my performance in the next station because they were all graded independently. So I had to see each new station as a fresh start or a way to get a better score, way to redeem myself. So I had to make sure that even though I know I did badly for a station, I wouldn't let it affect the rest of my stations because that'll be bad for my score. And a lot of I know some people who didn't pass the exam because of that. So the thing with PLAB 2 is you have to become, it's easier said than done, but I think being able to do mocks is helpful because you know what to expect already, and that kind of lessens the fear or the uncertainty a bit. So even though you don't know exactly how it's going to go down on exam day, as long as you replicate the experience, you try to do a full mock. Actually, before my exam, I wasn't even able to do 18 straight stations. I was only able to do at most, I think, 10. But even then, having the experience of
practicing
speaking with a patient, it was the same thing. And it just felt like in the actual exam, it felt fast, actually. So you wouldn't really notice the time. I think as long as you make sure to prepare for the setting, the environment, for the time limit, I think you'll be able to do well in the PLAB 2. Just make sure that you keep calm because you already know everything. You already know how to see patients. You've already done that in your home country. So the important thing is just to be able to transfer that to the exam setting. And I think everyone has the ability to do that.
Yeah. I guess the more you practice, I guess it helps, right? Yeah.
Yeah, it does.
Okay. Wow. At least you're done with the second exam as well. So that's amazing. Yeah. Each exam is just like a lot of things to work on and like logistical things and everything. So amazing.
Preparation is something else, especially with pandemic.
Exactly. It's too many changes and everything. So so now that you're done with
your IELTS, PLAB 1 and PLAB 2 exam, what's the next step?
So after passing PLAB 2, you don't automatically get added to the medical register. So you still have to undergo GMC or General Medical Council registration. So for my case, I was eligible to apply for a full license to practice. I know there's also a provisional license if you haven't done your internship yet, but since I already did mine, I'm eligible for a full license. And actually, it's really important to prepare ahead, because even during the time that I studied for PLAB 2, I was already fixing documents and preparing to get my EPIC verification, which was also important for registration to the GMC. So that takes a while. I think when they verify with your school, it could take up to could take how many weeks to like a month or even more than a month for some people. So I already started doing that while I was in the UK. I already sent all my documents, my diploma, just so they're able to verify you're at school. So the thing with EPIC verification is you don't have to apply for registration right after that. I think it's valid for a full year. So as long as you get it done, that's going to take away a big chunk of time that you would normally take if you would undertake the process for GMC registration after the PLAB. So I advise that between the time for PLAB 1 and PLAB 2, you already start doing your EPIC verification. And then after I passed the PLAB 2, there were a few more options in the website that was available to me. They asked me to input the rotations that I did in internship, like the dates as well. So I had to message our coordinator from the SMPH to confirm with me the dates, so that they would also put their signature to confirm that I really did my internship. And they need that as evidence of internship, so I had to get that done as well. Usually the GMC would email the documents that you would need to submit right after you submit those, right after you start applying. So usually the documents would involve your passport, your primary medical qualification, which is your diploma, a certificate of good standing, and your evidence of knowledge of English. So that includes either the IELTS or the OET, and then the evidence of internship. And then after that, I think it could take them a few more weeks to add you to the register, because sometimes they still email you to confirm some things. Like, for example, in the Philippines, the middle name is your mother's surname. So in the UK, your middle name is your second name. So that was like a bit of a mix up for us at the beginning. Like they asked me, okay, why is your middle name not in your evidence of internship? And then I had to explain to them, in the Philippines, it's just the initial, like that. So usually it takes them to like a week to reply, and so that takes a bit of time. You really have to get it done right first time.
And then, so you mentioned that you got a full license because you finished internship in the Philippines. For those who did not do internship in the Philippines, they get a provisional license, you said? And are the requirements different, like the process different? Like what are the main differences between those two, having provisional license and a full license?
I think with the provisional license, you still have to, like, you're required to undergo the foundation program. I think you're eligible to apply for the foundation program, which is like internship in the UK plus, like, that's like 2 years worth of postgraduate experience. So I think the only difference with the application for that would they wouldn't require the evidence of internship anymore, since you're going to be undertaking it in the UK. I'm not sure about the other requirements for that, but I think they would still be looking for your primary medical qualification, your passport, your English score, and your certificate of good standing, I think.
So basically, since you have a full license, you don't need to do the foundation years, right?
I still have to do another year just for experience, and then I can start applying for training programs if I want.
And what practical advice do you have, since you already underwent a lot of these processes, like based on the challenges you encountered? What practical advice would you have for those who will be taking PLAB 1 and PLAB 2 and taking this route?
The thing about taking during the pandemic, it's, everything is super uncertain. You have to be able to update yourself all the time. You have to make sure that you're updated with all of the latest guidance. So that's my top tip. Always make sure to check uk.gov for any changes. If there are any travel guidelines that you're going to put out, you want to be updated as soon as possible. Yeah, like in the middle of my preparation for PLAB 1, they added the Philippines to the red list. So I had to be able to change my plans on the fly. So I think if you're the type of person who wants to plan everything
ahead of
a
time,
year in advance, it could be a problem, because a lot of things will change. Even now with the variant
Omicron,
it could upend your plan. Yeah, right. So for PLAB 1, the biggest problem was the logistic. I wasn't even sure about the possibility of travel, but so I think my advice also for that is, as soon as you're sure that you want to take the PLAB, just go for it. Don't wait for a better schedule or something, because sometimes it's really difficult to book a slot. So especially these days, there are more people
applying,
taking that route. So you have to be able to ask. And and there's also like a lot of luck involved for me, because I was able to find the flights that I needed. I was able to book a visa. I was able to get my visa, because as soon as they added the Philippines to the red list, they suspended the issuance of visas at the time. So I was the only one who could go at the time. Yeah, at the time when they announced the red list countries, their classification, and added the Philippines to it, I was lucky enough to have already gotten my visa, so I could technically travel there as long as I passed through an amber or a green country.
Okay.
So yeah, so that was also a lot of luck on my part for that one. But it's also good that as soon as you have the opportunity to do it, it's much better to do it sooner rather than later. Although it was also a big risk at the time, so you gotta have a good appetite for risk. That was a lot of risk taken involved. That eventually worked out in the end. I don't really recommend that for other people, just because of the stress that I got while doing it. But at least now it's a lot of people are vaccinated, so it's much easier to travel. Not pre-pandemic levels, but it's still it's easier to
better than
navigate.
Before.
Yeah, exactly. So fortunately, it all worked out. So for PLAB 1, you could just study the probable. It's already enough, more than enough. A lot of the questions were very similar to the questions that I encountered in the question banks. And for PLAB 2, it's important that you find some practice partners to practice with. I know there are some people who practice like 30 stations a day, which is pretty much like, I think it takes them the whole day. But since a lot of my practice partners are also working, they also had their own families to take care of. We only had like an hour or two at a time to practice. So really got to make the most out of your practice and give each other honest feedback. I think if you're able to take the PLAB 2 with other people, it's also good if you travel together so that you could practice together. That was a struggle for me when I did mine. You just need to be able to do a lot of practice, and it's important to refine your approach. So that was the advice that Kim gave me that was super helpful. You have to I think by encountering all of the different cases, by identifying the key points, like how to identify the disease or illness, and then the management and diagnostics, I think that's what you need to study in terms of like knowledge already, your own flow or your own approach to every patient. So for example, if you have a difficult patient, you have to be able to know what you're going to do if the patient is a very stubborn kind of patient, or someone who yells at you. You have to be able to account for all of those different scenarios. So I think the communication skill part is very important as well. And being able to do all of that within the time that was allotted is very important because they grade you for every part of the interaction with the patient. Yeah. So if you don't get to discuss your management or give them advice on what to do, or if you don't get to tell them your planned treatment, it's a waste not to be able to get those points, because just being able to mention them would help. Yeah. So to get there, you have to be able to do your history very thoroughly. You have to know what questions you need to ask. So because sometimes if you ask a patient something, like their actors are very well trained. Like that was an important thing that I realized looking back for PLAB too.
Okay. Yeah, I guess it's really important to manage your time wisely.
Yeah.
In every step. Yeah. I know that in the past 2 years, or well, just the past year, there was a lot of changes. So my question is like, what are the important changes or information people should take note of in pursuing this journey?
Okay. So since this route is a very attractive option, it's already starting to get more competitive as time goes by. And since like they have a visa, especially for healthcare workers, it's much easier to, the process is much more streamlined, and it's easier to find work compared to before. So you had to satisfy some criteria for the resident labor market thing that we don't have to worry about anymore, since healthcare is like considered one of the important skills. So it's much faster to get a visa for work. So because of that, the competition has increased as well. So they released recently the competition ratios for the specialties. So and as expected, because there are a lot of new doctors that are coming in from all over the world, it's gone up. So just to explain for those who haven't heard of competition ratios before, they're calculated by dividing the total number of posts available for every specialty by the number of applications. So simply put, it's a metric for how competitive a specialty is. So for example, if you want to go to surgery and the competition ratio is, for example, maybe like 3, there are 3 applicants for every slot available. So yeah, so I've seen a lot of increases for all of the different specialties. What are the implications for that, you might be wondering. Because there are so many applicants vying for a spot, the trend that I'm seeing is that some specialties are starting to make changes in their portfolio scoring criteria, which involves, like, it's kind of like your resume. So they weight your achievements differently. They increase your previous experience. It depends on the specialty, but some already require that you take the MRCS, which is another exam. Some of them require that already, or some of them would require attendance to conferences and such. So you have to be updated with that as well. It might seem a bit far away if you're still trying to apply for PLAB 1 and 2, but this will eventually affect you if you're planning to go into specialty training. So it helps to know about that ahead of time, especially if you're trying to build your portfolio. You can do that as early as now. Even if you're still in your home country, you can do that. So there is a lot of preparation and thought you have to do. So you have to keep yourself updated at all times. So that's one of the updates that I've seen. And then if you're going to take this route sometime in 2024, they're also having a new exam then. So they have the UKMLA, which will replace the PLAB when you're trying to apply for registration to practice in the UK. So the difference with PLAB for this one would be where in PLAB, only international graduates would take the exam. For UKMLA, it would also include all the UK medical graduates. So we don't know yet how it's going to be in terms of competition, or if it will be harder, if the content will be different, or the question types. So if you're starting your journey at around this period, it might be a bit more challenging, especially because since it's a new exam, there isn't as much knowledge about it, or there aren't a lot of resources available for it yet, compared to PLAB. So if you're trying to work in the UK at around that time, you have to be prepared for that as well. And of course, they're also now super current, the Omicron variant. So I guess that's also one of the things you have to look out for, because of course the travel guidelines will change again.
Yes,
you might need to get might have to have your booster first before traveling. It will depend on the countries that you would take your exam in, especially for PLAB 1, since you can take it at several locations. And if you're going to take the PLAB 2, it's all just going to be in Manchester. So you also have to be aware of the guidelines when you're traveling. Yeah. So those are the major things that I suggest to keep yourself updated with if you're trying to take this route.
Okay. Wow. Those are helpful points. Yeah. To remember, just keep up with all the guidelines and all the requirements and things that can make you a better candidate for application in the future. Yeah. So through this process, what are the things you were grateful for despite all the challenges, and what are you looking forward to in the upcoming days and months and years, I guess?
Well, for this journey, since it felt like uncharted territory, because it wasn't like anything that my predecessors or the alumni or the people I knew from the upper batches went through. They didn't go through the pandemic, for starters, except maybe Kim. But it was very challenging because you had to learn how to navigate, and you had to it felt like you had to make the right choice every time. So there was that pressure. So I was super thankful for, and I still am super grateful for my family, because they've been super supportive of this journey ever since I decided to take the IELTS last year. It was just like a roller coaster ride from them. So yeah, even when I was still thinking about taking the PLAB, my mom was already contacting our relatives in the States and in the UK, just so I could have somewhere to stay, or so that was very helpful. And I think being able to have people to vent to was super helpful, because it was just a difficult journey.
Yes, I agree. That's very important.
So I'm super grateful for that. My friends were also they were also super supportive the whole process. There were times that I couldn't be as present because I had to study or plan for things. So their understanding was very important to me, and that was something that I'd always be grateful for. And I think being able to have them to lean on was very helpful in terms of my mood and my mindset for taking the exams. Mostly, grateful for my friends and family. A lot of it was also luck, but mostly the support
system,
everyone around me. It's really important to have a good support system. And I think if you keep thinking about the end goal, it could also serve as motivation. So what kept me going also was the excitement of being able to finally be able to travel somewhere, be able to go and explore. I think that's also that's also part of the excitement for me. So I think that was also something that I was grateful for, and being able to travel. I was very fortunate to be able to do that, even if it was just for the exam.
Nice.
It's a lot to be grateful for, definitely. And I think I also asked something about what I was looking forward to. Currently, I'm applying for jobs since I already got my full registration. And
congratulations!
So it's exciting. That part is exciting. A lot of those just closed their vacancies. A lot of them just closed the ads for the jobs recently. So I will have to wait a bit before hearing from them again, because we had to go. I think they have to do some shortlisting, and then they will contact you for interviews. So I still have to wait for those. But I'm looking forward to getting a job and eventually moving there. It's been a hell of a year, but I'm looking forward to working more than ever, because I also miss working in the hospital. I also miss seeing patients. Right. Even just seeing patients for a bit, I think that also made me realize how much I really enjoy
it, and you enjoy. Me too. I totally felt that too.
It was so nice to even though at the time I was still getting used to the system, and I still didn't know a lot about how things worked in the NHS, being able to just educate the patients, or give them comfort in that way was very uplifting for me personally. So I really look forward to working now. It's so nice.
I super agree with that, because I felt the same when I was doing like a rotation here in New York. I was like, I miss this so much, like seeing patients and
Yeah.
like being able to talk to them and like explain and like seeing
Mm-mm.
how much they appreciate things like that, and like
Yeah.
just being in the hospital or being in the clinic. I also realized that it shows how much we love being in the clinical setting. So is there anything else you want to add?
Like with any journey, especially for every IMG, it's going to be very challenging. But as long as it's something that you really want, I really think that you can achieve it. Like you can really eventually work where you want to, as long as you just keep on going at it. Don't get disheartened by any setbacks, because eventually, I think if it's really something that you persevere towards working toward, it's something that will be possible for you eventually. So I've seen that with a lot of people, even especially during PLAB too, because a lot of the people that I met at the academy while I was doing my mocks, a lot of them came from different walks of life and
Yeah.
having, I mean, a lot of, yeah. So I met people from all over the world at the time. I met people from the Middle East. I met someone from Canada at the time. I also met someone from Nigeria. You really meet all of these people, and you just realize that the journey you're in is truly exciting. You get in, like, in the process of learning about another country's health system, you also get to know about all these different cultures, also get to meet lots of different people. And I think that's also very exciting and something that you should really welcome and look forward to when you're going through this journey. Because you all have different situations, but you all ended up there preparing for the same journey. So I think that was a very inspiring realization for me, that no matter where you come from, it's possible to achieve your dreams, as long as you just keep at it and pray and just really make sure that you're prepared. Getting to interact with all these people was very inspiring for me.
Yeah,
so
that's true. I agree. If you keep at it, no matter how hard it is, right? You eventually get it. Yeah, you'll get
like,
there. Yeah,
yeah.
I agree. Thank you so much for your insightful advice and for sharing with us all your experience. And again, congratulations for coming this far. And I wish you all the best
you so
for
much.
the rest of the journey and looking for jobs and like interviews and getting the jobs and eventually moving there to work. So I'm excited for you. And yeah, thank you for being here with us today. So thank you so much for tuning in today on this video. If you like the content of the video and if you found this video helpful, don't forget to comment, like, and subscribe down below. It's going to be really helpful for me. I'll see you guys next time. Bye.